Hello and welcome, it's Chris from Christopher Holt Training and welcome to this week's tutorial, which is 7 guidelines for exercise for low back pain rehabilitation. A little bit of a mouthful, but basically we aren't talking about specific exercises, we aren't talking about specific anatomy. We're looking at how you need to plan and think about your exercise for low back pain rehabilitation program. So we're going to be covering these 7 guidelines, which are hopefully going to help guide you in what you need to be doing on a daily basis and how you need to be thinking about your state during that exercise, not only workout, but regime over weeks, months, or years. Now, before we get into that, just quickly mention my social media. So if you want to come along to Twitter, Facebook, Instagram, or YouTube, please do like, follow, and subscribe. It'd be great to have you on board. Please do stick a comment below if you find anything interesting. If you have a question, whatever it might be, pop it in the comments below and I'll do my best to get a reply to you as soon as possible. Alternatively, you can come along to the website christopherholttraining.com, and if you use the link which is at the bottom of the screen, which will be in the description in some way, shape or form, you will be able to sign up to my webinar, which is all about exercise for low back pain. I talk about the method that I use, I talk about how you can apply it, and I also give you an opportunity to get involved in the 12-week online training program that I have available for lower back pain. So that's the business done. Let's get stuck into the tutorial. So what are we talking about? It's the 7 guidelines for exercise for low back pain rehabilitation. So number 1 is you perform small bouts of daily exercise. So what we are thinking about is a few exercises. So it may be 3 or 4 exercises on a daily basis. It might take 15 to 20 minutes to complete. There will be some stretches involved, there will be some exercises involved, and there will be some movements involved. So what we want to be doing is small bouts of exercise on a daily basis. The next one is to perform these daily exercises 1 to 2 hours after getting out of bed. So that doesn't mean you have to do it in the morning 1 to 2 hours after getting out of bed. It just means don't do it in that period, because what happens in your discs is they are more hydrated early in the morning, and that can change the stresses on the discs throughout the day. So we want to be able to do that outside of that window. Pain, no gain. So the normal saying is no pain, no gain, and that's what normally comes with exercise. So a lot of people promote you got to be working hard, you got to be feeling muscle pain to get the gains. Now, in fitness training, if you are training as a bodybuilder or to improve fitness for a specific event or whatever it might be, there is some merit in that saying. When it comes to lower back pain, if you're in pain, you're not getting the gains you want. So what we've got to think about is removing that pain and eliminating any pain from exercise, specifically in the lower back, hip and core area. So we want to stay away from any pain in that area. We don't want to be instigating any muscular pain, so we don't want to be fatiguing the muscles like you would normally. So if you can imagine just doing bicep curls, keep doing them, eventually it's going to be painful, you're going to get that muscle fatigue and the muscles are going to fail. Fitness training, that might be fine if you want bigger biceps. With regards to lower back pain rehabilitation, we want to avoid that. The next one is include a walking program. Now, that doesn't mean just ambling around. What it means is a structured walking program. So, for example, you might find that walking helps relieve your pain. So if we can walk with better posture and walk in a more focused way with better technique, so there is a marching element to it. So we are being, what's the right word? We are being very sort of assertive in our walking posture. So we are marching rather than just ambling, or we are fast walking rather than just ambling. Then that's going to lubricate the hips, which is going to start reducing the stress on the lower back, which is then going to start helping relieve lower back pain. Now again, what comes with that, if you experience pain after say 10 minutes of walking, you may only do 7 to 8 minutes of walking, have a short rest break, and then do another 7 to 8 minutes of walking, and then you can then continue on with the rest of your day. So what we are doing so far is including small bouts of exercise on a daily basis. So that might be planks, side planks, bird dogs, bridges with some stretches involved. You would do that after the first 1 to 2 hours of getting out of bed. And then we want to start when we are walking around in life, or we can actually add in a structured 10 minutes. We include a good fast-paced sort of marching assertive walk with good posture, and that is our fourth guideline. The fifth one is focus on low intensity. So as I've mentioned, with regards to pain no gain, we don't want to be focusing on muscle fatigue. If we're doing that, we're focusing on medium to high intensity training. Our training wants to be low intensity. Now, there are no set repetitions, because what we might find is that after 10 repetitions, it starts to become fatiguing or it starts to become painful. So what we would then do is we would focus on just doing 8 reps. Then it might be 6 for the second set and then 4 for the third set. So what we're trying to do is we're using that sort of no pain idea when it comes to training and sort of turning that into our exercise. So we're using the reps accordingly. We're not saying you should do 3 lots of 8 or 3 lots of 10 or 3 lots of 12. We're saying do the repetitions so you don't experience or trigger any of the pain in your lower back or hips. Number 6, there are better and worse exercises, but you have to find the right ones. So where I'm suggesting planks, side planks, bird dogs, bridges, those are better exercises. But if some of them trigger pain because of the technique that you're using or because of the posture that you're in, you might think about avoiding them. If they are triggering pain after a certain period of time, you might want to adapt those exercises so you're only doing them for as long as is pain-free. So you're thinking about, okay, yes, there are better exercises and there are worse exercises, but I've got to focus on the exercises where I don't experience any pain. And then the final one is track progress. So this relates to another tutorial that I've done, which is about the low back pain journey. What you've got to do is before you start, you've got to think about, okay, how often do I feel the pain and how intense is the pain? So I feel it daily and it's a 7 out of 10, 10 being an excruciating pain. That's your starting point. That's your means of measurement. You would follow these previous 6 guidelines during a workout program or exercise and stretch program. And what you would then do is you would then in say 4 or 6 or 8 weeks time, you would then go back through that sort of tracking of the progress and say, well, okay, how often do I feel the pain now? Well, now I feel it every other day, and it's at a 5 to 6 on the intensity scale. So what you found there is that it started to improve. So the exercises that you've been doing have started to improve it. You would then go through exercise and stretch program again, walking program again, and then in 4, 6, 8 weeks, you would think about, okay, well, has it got down to maybe I'm only experiencing pain 2 times a week, and the pain has got down to a 4 out of 10. So that is tracking progress, and that is how you overcome lower back pain using exercises and stretches. So when you're starting to think about, okay, I need to do something about my lower back pain, I need to start building a program, these are the guidelines that you need to follow. Small bouts of exercise daily, done outside of the first 2 hours after getting up out of bed. If you're feeling pain, you're not getting any gains. So if there's no pain, then you are gaining. Include a walking program. So that's focused marching walking for say 10 minutes 3 times a day. Focus on low intensity. That's with walking, the exercises and the stretches. When it comes to the exercises and stretches, there are better ones and there are worse ones. And then finally, track your progress. So track that progress over time to see if what you're doing is working. So many thanks for watching. I hope this has been helpful. If you want to find out more about the webinar, click the link below, or alternatively come along to social media, and I hope to see you on one of the programs. Speak to you soon.